Ready anytime, Andy.
Good morning, Dr. Anthone. How are you?
Doing okay. Going fast again.
I imagine. Well, thank you for joining us today. We'll go ahead and get our call started, and we'll go ahead and put up your PowerPoints.
Thanks, Andy. Hello, everybody. I'll give a few updates on hospitalizations first, and then just a little bit about the vaccine breakthrough hospitalizations, cases, and deaths, and then a quick update on vaccination. And then I have an announcement to make that'll be press conference at 3 o'clock today with the governor, and I'll have a little bit of updates on that. The governor has asked me, though, to embargo the information that I'll give you on the press conference today until after the press conference is over. If we could just keep it to ourselves, and then after, I think at 3-4 o'clock, we should have that out publicly. Anyway, for the hospitalizations ending this past Sunday on August 22nd, where Andy's arrow is, we are at 287. Today, we are at 337. So we're increased by 50 patients just the first 3 days this week. I know everybody's feeling the volume of cases coming in, the COVID cases, and overall hospitalizations. Our test positivity rate for the week did go down to 7.1%, partly due, Matt Donahue is giving information that a lot of the colleges that are back in session now are doing a routine screening and surveillance. And so that is a lot more tests coming in and a lot less positive tests coming in. So that's why one of the reasons why the test positivity rate went down by almost 1.5% this week. Our patients on ventilators went up quite a bit this week to 45, an increase of 17 patients on ventilators statewide. Douglas County again saw an increase of about 12 patients to 116, with an increase of 9 patients on ventilators to 19. Lancaster County actually had the largest increase of any county this past week, with 20 additional patients in the hospital, up to 84 this week, and with an additional 6 patients on ventilators. So we remain testing about 58% of the Nebraska population at least once, with 12.3% positivity rate for those being tested. Our case fatality rate remains low at 1.0%, and really hasn't changed now over the past 2 months. Our patients in the ICU statewide did go up again quite a bit to 101, an increase of 26 patients statewide, an increase to 48 in Douglas County, and 17 patients in the ICU in Lancaster County. So overall, a trend of an increase for hospitalizations again this week. This is, and I'll just have a little bit of a editorial on that when we get to the third slide. So we go to the next slide, please, Brian. The curves for the statewide, you can see going up. It's a steeper curve than what we saw back with the UK variant, Alpha variant, back in the end of March, early April. So definite steep rise here due to the Delta variant. Almost all positive cases at this time in the state are Delta variant cases. And you can see similar rises again corresponding to the statewide increase in Douglas County in green and Lancaster County in red. So then our next slide will just give sort of the editorial. We had an increase of 41 patients. We have now had our 8th consecutive week of an increase in hospitalizations. If we go back to July 4th being the increase or the start of our surge, where we went from a low of 27 patients to 46 patients starting at the week ending July 4th. So 8 straight weeks of an increase in hospitalizations. Our number of cases also continued to rise. We averaged 555 new cases per day last week, which was up from 435 the week before. So again, this was our 9th week of an increase in new cases in the state of Nebraska. And that corresponds with what we usually see. Cases go up about a week before hospitalizations go up. We are testing quite a bit more. Last week, we tested an average of 9,200 cases, our tests per day. an increase from 6,400. Again, mostly due to the universities being back in session and doing their screening and surveillance testing. We did have an increase in our 14-day average of staffed hospital beds occupied by COVID patients to 7%. And that's a 14-day average. Today, we are at 7.6%. If you don't do the 14-day average, if you just do a current day average of what we're at for today with our hospitalizations at 337, we are at a 8% staffed hospital beds now in the state of Nebraska occupied by COVID patients. 35% of hospitalized COVID patients are in the ICU, and 4% increase from last week, and then quite a bit of an increase in the COVID patients that are in the ICU on ventilators, up to 45% this past week, up from 37%. You can see the trends over the last several weeks. Another large increase this week in statewide ICU patients that are COVID patients went from 18 to 27% this past week compared to last week. And we had an average of 31 new COVID patients admitted per day last week, up from 26 the week before. So that's pretty much the hospital data at this point. If we'll go to the next slide, Brian, you can see our breakdown of COVID cases that are vaccine breakthroughs, the cases and the hospitalizations and the deaths by vaccination status. If you look from the beginning of the year, January 1st, 2021, to the week ending August 21st, 2021, 95% of vaccine breakthrough cases are in the not fully vaccinated group, has not completed 2 weeks after their second dose or 2 weeks after their first dose of J&J. Our hospitalizations for this time period, 8.5 month time period, is 95% of hospitalizations are also in the not fully vaccinated group. And 96% of patients that have died have not been fully vaccinated. So if you can see the trends though over the last month from July on the second part of the right-hand side of the slide there, from July 25th to August 21st, you can see the Delta variant has affected the vaccine breakthrough numbers. The actual cases that are vaccine breakthroughs are about 78% now, rather than the 95% from the whole time period. And the hospitalizations remain about 88% in the not fully vaccinated group. And Matt Donahue does these numbers as saying we can't really rely on the deaths because the denominator is really small. So can't really comment on that, but that's what we have for that time period. Death certificates usually lag by a couple of weeks, so our denominator is very low there. And then lastly, just to give you a snapshot of our vaccination status on the last slide. You can see by local public health district or local health district, the breakdown of individuals vaccinated and 65 and plus fully vaccinated is at 82% statewide, 65% for the 50 to 64-year-old group, and so on down the line. The 0 to 15 age group is at 8%, and the population with at least one dose of vaccine in the 0 to 15 age group is up to 11%, a 2% increase from 2 weeks ago. So we are seeing again still an increase in the number of individuals getting their first dose here over the last month again. I think I mentioned we are on target for about a 40% increase in August compared to July. I don't think we're going to reach that 40%, but we'll still have a fairly significant increase in the number of new doses administered during the month of August. So that's pretty much the summation of the hospital data and the vaccine breakthrough data and the vaccination data. I'll take any questions if there are any up to this time, and then I'll go into what will be talked about at the press conference today at 3, Andy.
One of the things I have, Dr. Anthone, and thank you for those numbers, are we're seeing some issues with testing supplies and allocations, in particular in the southwest part of the state. It appears now that the only testing they have will have a 24 to 48 hour return. And so They're just asking if you're aware of any additional Abbott ID Now test kits that they could use, or even they'd be willing to purchase from the state if they have any.
Just had a briefing on that this morning, Andy, and we should be able to get a very good supply of the Binax Now cards coming in to the state, most likely distributed through the local public health departments. Can't give you an exact timeline on that now, but they have told us that we can order a fairly large supply of those Binax Now cards. We're also working on testing and funding for that testing. Again, can't give you a timeline on that, but obviously, those are two concerns that we're hearing about, and our group is working on right now.
Good, great to hear that.
Yeah.
Any other questions for Dr. Anthone today before we move on?
So again, the governor will be doing a press briefing today at 3, and he asked again that we embargo this information until after the press conference. The main issue is around hospital staffing capacity and how we can increase that. And so the first will be an executive order that the governor will be signing, basically going back to some of the orders we had at the April of 2020, where we did waive, such as, I'll give you some specific examples, the credentialing of retired or inactive health professionals, deferring continuing medical educational requirements for your license renewal, deferring initial license fees for healthcare providers, waiving requirements that healthcare professionals submit test scores before issuance of a provisional license. However, once they know the results of those scores, and if they are not a passing score, once that's known, they will not be able to continue working in that level of a license. They can assign them to lesser duties, such as if it's a nurse, they could do nurse aid work or things, but won't be able to work once they know the results of their test scores. But during the interim period, when they don't know those results, they can still continue to work off their provisional license. And there's a lot of other statutes that'll be raised for supervision ratios, and then some requirements for this will be mostly for childcare, for fingerprint checks, things of that nature. So all in all, those waivers will be going into effect immediately after the press conference. So it should help out somewhat in some of your staffing issues.
Terrific. That is great. Do you know, and so thankful for that, and we'll look forward to digging through those and kind of unpacking what's there. Do you know how this will impact the COVID dashboards return or the transfer center? Any new news to share on those two fronts?
Won't be announced today, Andy, but stay tuned.
Okay.
It should be fairly shortly on both
Great.
those issues.
Thank you. Yeah, as you know, that is one of a lot of other issues we have going on, but that is one we continue to hear is for planning and purposes and kind of checking without the state. So
one of these executive orders for the waivers will be allowing us to put the dashboard back up to share the data county by county or local public health district by local public health district. So that's what we're working on right now.
Perfect. Great. Thank you.
And then as far as the transfer center goes, again, stay tuned on that.
Any other questions or comments from
I have one other announcement that'll be given today, and that'll be on elective surgeries. The governor will be issuing a directed health measure to ask all hospitals statewide to postpone Class D and E surgeries effective on Monday at midnight. Monday at 12:01 a.m. and effective through the month of September. So I know a lot of hospitals are voluntarily doing that now, and we appreciate that. But because we see this as more of a statewide issue, as far as the need for patient transfers between hospitals, things of that nature, we feel we need to do a statewide directed health measure for Class D and E surgeries. Everybody knows Class D is any surgery that can be delayed up to 4 to 12 weeks without harm to the patient, should be delayed. And any Class E surgery that could wait greater than 12 weeks should also be delayed. So those will be the updates today. Again, the governor asked to keep this embargoed until after the press conference today, but just wanted me to give your members, Andy, a heads up on this.
Thank you, Dr. Anthone. That's appreciated. Any other comments or questions today from the group for Dr. Anthone?
I usually recognize when there's no questions, Andy, that I know it's a lot to digest in one day. I think, we're just seeing this as not really a COVID staffing emergency, but more a healthcare emergency, and that will be how the orders will be written.
Perfect. Well, thank you for all that work, and we appreciate your work on this and with the governor and bringing back those DHMs and or executive orders, I should say, and appreciate that. And we'll go through those and make sure we have all the understandings. But thank you for all your work, and we appreciate you being in touch. And we will talk to you sooner than later, I imagine.
Thank you guys for all your work too. We really
Thanks, Dr.
appreciate it.
Anthone.
All right.
You
Bye
bet.
now.
Take care. Bye-bye.